Hey everyone, this is Reggie from Result Plus Physical Therapy. In today's tip of the day, I want to give you an idea of the process, the recovery process, to be more specific, of having a total knee replacement. I see a lot of patients with total knee replacements in the clinic, and one thing that is very common is, especially at the beginning of the rehab process, a lot of the patients are surprised of the length of time, the amount of work, and also the pain at the beginning that they have to go through in the recovery from that surgery. So I want to give you an idea of exactly what will happen so that if you do decide that you need or you want to have a knee replacement, you will not be caught by surprise. You'll know what to expect. Right? Because I have some patients who told me, if I had known this, I would not have done it. But you know what? The thing is, there comes a point that if you really need it, meaning you can't walk anymore, you're in pain all the time, or a lot of pain all the time, doesn't matter how hard the recovery process is, you will have to do it. But at least you can make that decision. It's an informed decision. All right. So this is what's gonna happen. So once you have the knee replacement, a lot of times people, patients stay a couple of days in the hospital. This is if nothing goes wrong, right? Barring any medical complications, they stay there maybe 2, 3 days. And then depending on the surgeon, the hospital, or also sometimes the insurance plan, they can get discharged going into either one, a skilled nursing facility, subacute care, or they will get sent home, and a home therapist and nurses will visit the patients at their house, get them walking, get them started with the exercises and wound care and stuff like that. All right. So now, after that process, the patients most of the time will undergo outpatient physical therapy. But even though the patients are undergoing outpatient physical therapy, they still have to do exercises on their own. They will still have to do things on their own. Now, the whole recovery process from a total knee replacement can be around 6 months to a year. That's the time frame that I like to give my patients. 6 months to a year to be back to normal, be back to their full function. Now, it all depends on how you heal. A lot of my patients, by 3 months, they usually stop their outpatient physical therapy already. 6 months is a good time frame for them to be feeling either no pain or just a little bit of pain here and there. They should be able to do most of their regular activities, meaning walking, climbing steps. They should be back to work either sooner than that, depending on the type of work that they're doing. So usually 3 months, if they're healing properly, they go back to work 3, 4 months. So 6 months is a good time frame to say that the patient should be functioning pretty much normal and independently. But overall, it's 6 months to a year. If you have other medical problems like diabetes, then that takes longer. I usually estimate the recovery for people with diabetes. I double the length of time. All right. Now, what should you expect during the physical therapy, or even when you're doing it at home? One, after the surgery, definitely you're going to be in pain. The first couple of days you may not be, because they will have the anesthesia. They usually give you narcotics, things like that. So you won't be in a lot of pain. But once the anesthesia wears off, once they stop giving you the narcotics, then you're gonna start feeling the pain more. Okay, some of my patients don't feel a lot of pain. Some patients feel a lot more pain. Depends on your pain tolerance. The thing is, you will have to bear with some of that pain. Okay, it's unusual that patients do not feel. I've seen those patients that they don't feel, like pain, or they have very minimal pain, but that's not very common. All right, so do expect the pain there. Do expect to put a lot of work in, because you will have to move that knee. You will have to do your stretches. You have to do your strengthening exercises. You will have to do your icing, because that will help keep the swelling down, keep the inflammation down. Okay, the moving, the stretching, those exercises are very, very important because you don't want that knee to get stiff. Okay, you don't want to have to go having manipulation under anesthesia later on. Okay, so early mobilization is key. Very frequent mobilization is key there. Okay, and then of course the strengthening exercises, you can start with isometrics, going to resistance exercises and functional exercises. But those will be difficult at the beginning also because of the pain, because of the inflammation, because of the swelling. At times patients will feel that their knee is very stiff. You have to bear with that. You have to keep doing your exercises. You have to keep doing the stretches. Okay, so it will not be easy. Be prepared to have some level of pain. Be prepared to have some level of discomfort. Be prepared to have some sleepless nights, or less, the quality of your sleep will not be as good the first few weeks. And usually that gets, most of the time, that gets better as you go away from the surgery. All right, and I'm not saying all these to scare you. I have a lot of patients who undergo that. My mom is one of them. She underwent her knee replacement a couple years ago, and now she's actually thinking of having the other knee done because the other knee is actually giving her problem now. It will give you kind of like a new lease on life once you recover, but there's a road to recovery there. I'm not trying to scare you. I just want to make sure that you understand what you're signing up for, what you're getting into. Okay, you will have to put the work in. You will have to bear with some of the pain, some of the discomfort. Okay, now, but once you pass that and everything is once you recover from the surgery, you'll be glad that you had it done. Most cases, my patients are glad to have it done. Okay, so now at least you know what to expect. I have some of my patients say, "Oh, my doctor didn't tell me this. They told me 3 months, 2 months, and I'm good." It depends. The definition of good is relative, right? So this is the way I see with my patients. I just want to be as upfront as possible, so that when you do the replacement, when you know what to expect, you'll be more prepared, and then you put in the work, you have a more successful outcome. All right, so I hope this gives you a clear idea of the recovery process that's involved after a knee replacement. Thank you very much for your time. I hope this helps you out. If you know anybody who will have or is having or had a knee replacement, please share this with them so that they can be prepared also, or they know what they have to do, or what they're going through is part of the process. All right, so thank you very much for your time. Appreciate it. Remember, need you to comment, like, subscribe, and share this video so that you can help make other people's lives a lot better, especially if they just underwent a total knee replacement or they are undergoing a total knee replacement. If you have any questions, I would love to see them in the comment section below, or any what do you think? I want to hear what your thoughts are. All right, so I will see you on the next video. If you have any questions, feel free to reach out. You can email in the comments, or you can DM us directly. I'll see you in the next video. Bye.